guys. Welcome to the podcast today. It's very exciting. It's a great topic, actually. I've been excited to do this topic for a long time, and we're here to do the topic. And the topic is going to be on hair restoration. I waited to do this topic for a few reasons. Not to grow back hair. That was not the reason, but the main reason is to get the most research that we can, because there's a lot of things that happen over the last few years with hair restoration, the newest kind of cutting edge data, and so I wanted to try to get the best kind of research, the things that are working the best, the things that are not working as well. And so I'm gonna put it out to you in as best fashion as I can, give you the best data, the research that shows that things that are working, things that are not working, and things that are kind of are less consistent than others. So I think we've got a pretty good handle on what we're going to be dealing with today. So, of course, I have my trusty co-host again with me today, Zoey. Welcome back, Zoey.
Thank you for having me. It's a pleasure, as always. And we're getting the full treatment today here at the Modern Man podcast. Our assistant producer, Joanne, she's our camera girl. She also hooked me up with an IV for vitamin therapy because I'm nursing a migraine. So shout out to her. Make sure if you also need, if you're feeling dehydrated, or if you're just getting over a cold, or like me, struggle with migraines, come to Simply.Aesthetics so you can get an IV.
Oh yes, absolutely.
So shout out to her.
Yes, thank you, our producer, because she helps us in so many ways, and she helps the podcast go on, because it'd probably be hard for you to go on with this podcast with your migraine. So it's a good thing.
Absolutely, yeah. So shout out to Joanne.
Shout out, Joanne. Good job.
Maybe we'll get her to come on the podcast one day. We'll see. We've been trying for a while.
Yes. We'll have to twist her arm, but we'll see.
But yeah, I'm really excited about today's topic. This is the technology in the last couple of years has really advanced in hair restoration. And I know this is a topic that you care a lot about, and I'm excited that we're finally getting to talk about it.
Yeah, I think a lot of people in the community have, the Modern Man community have kind of asked me about it. A lot of people talk about it. It has been something that a lot of people, both men and women, have discussed. So, I think that it's something that is really timely. Just to go back to, like as far as, we always go to our, our cultural icons. And I think the first icon who was, had no hair on TV was Telly Savalas, right?
As he played, as Kojak,
yes,
the detective.
Yes, and he was
before that. Since him, the only leading men that I can think of are like Bruce Willis, yes, and Sean Connery, but not everyone can pull off the Bruce Willis look.
Yes, I think Vin Rhames. I mean, he's done a couple of movies where he was.
That's true.
Yeah. But yes, it's true. But Telly Savalas was I think the first. But interestingly enough, in the research I did for the podcast, there was a lot of pictures where Telly Savalas had hair.
Do you think it was a hairpiece?
I don't know. That's a good question.
Well, if you're someone that has to wear a hairpiece like a toupee, yes, and you don't like doing it, I think you'll learn some useful information today on today's episode.
I think so. So, so let's talk a little bit about the different types. So this is gonna be a pretty comprehensive podcast. We'll see if we could make it in one podcast. We might have to break it up to two. I don't know. We'll see. I mean,
there's a lot of information.
There's a lot of information, and we'll do our best to see what we do. But I'm not gonna cheat you guys. So I'm gonna give you all the information, and if I have to do it in two separate shows, we'll do it in two separate shows. So we'll decide once we get to that point.
All right, let's get into it.
Yeah. So the first thing we got to know is that it is really important to understand that the earlier that you get to and find find the hair loss and kind of work on it, the better. And this is because of the fact that there actually is two different types of hair loss, and they break it. The categories that are broken down are called scarring and non-scarring. And when the follicles are scarred, it essentially means that the follicle is pretty much non salvageable, and that is not going to come back no matter what. The non-scarring follicles, these are follicles that can come back, and they are recently recently lost. They're recently kind of had the ability to come back, and these are the ones that we're really going to focus on. So if you have a decent amount of loss and it's been for a while, it's going to be hard to kind of work on. Secret that we'll talk about today is that our producer actually did a PRP treatment on me.
That was earlier this week. How did that feel?
It actually wasn't that too bad. She really enjoyed it because she didn't numb me.
Oh no! So our producer was getting back at you for all the time, all the mischief you caused,
yes,
and the shenanigans in our office.
That's true. That's true. And but yes, I mean, and so we focused on the areas that we felt that were most likely viable, because of the fact that there are probably areas that are probably scarred because at the time that that I was losing my hair, that I didn't have all this information, and it wasn't as important to me at the time because I was too busy studying, and I guess it just wasn't really important. But now I kind of am interested in it, and so I'm going to try a lot of these treatments that we're going to talk about today, and we'll see what comes out of it. But for most people, if you start seeing, if you are somebody who has like a decent amount of hair, and then all of a sudden you notice that, hey, I feel like I'm starting to lose my hair. Do you know how much hair you've probably lost by that point?
No, how much hair?
About 50% of your hair by that point.
Wait, so because everyone sheds hair normally,
right?
You get in the shower or you brush your hair, the dead hair you lose is normal.
Correct.
But by the time that we notice ourselves that, oh, I think I'm losing hair, this feels like more hair than normal, that's 50%.
Correct. So when you start seeing, like, I see like I see a spot, I see an area that seems like really thin, most people have lost about 50% of their hair by that time. So that's a significant amount. And so you would like to try to stay away from that kind of area. So it was really kind of shocking to me when I did this research to find out that that's the case, that by the time you kind of see a spot on your scalp, that you've probably lost up to 50% of your hair by then.
But that's not too late to start getting treatment done, right?
That's correct.
Okay.
Yeah. So I mean, by that point, you still probably have a good amount of non-scarred follicles because of the fact that like you are shedding and you're in a certain phase, but the active phase is you still have enough follicles that you can get those follicles reawoken. And we're going to be talking, like I always stop at the point of surgery or any kind of invasive treatments on the podcast, because we don't, we just don't talk about that stuff. We talk about more natural kind of approaches, and so we're not talking about hair transplant. So we're going to talk about all the cutting edge things that you can do up to transplant. We're not going to be going to
right,
transplant.
because transplants can be a little scary. It's a little intimidating.
Yeah. And quite expensive too.
Correct. So I have a question. What's the difference between a dead or scarred hair follicle?
So essentially, it's a very similar kind of process. Like essentially, the nomenclature, I would say, is probably the same. I mean, a scarred follicle is a damaged follicle. A dead follicle is a non-functional follicle.
Gotcha. Okay, so that makes more sense. That there's been trauma of any kind or of any level.
Correct. And we're going to talk about certain things that you might be surprised that actually can scar a follicle.
Oh, all right.
And we're going to get into that, and it's going to be really interesting. And so, and one of the things I said earlier was that that maybe you even kind of might be hearing, Zoe, that like there's a lot more people out there that have talked to us about the fact that they're having thinner hair, that seem like their hair is not as thick or thinner, both men and women. Of course, this is a Modern Man podcast, but we always talk about women too.
Right. So, I mean, if you're the Modern Man and you can give a special lady in your life some advice,
yes,
this is always, they're going to really appreciate it.
Right.
So good for all you guys out there to know this as well.
Yes.
But yeah, people have definitely been talking more. I know that I feel like I've been more stressed than normal from the last couple of years.
Yes.
I've also heard that you can have hair loss as a part of a post-COVID result. Is that something that you've heard or people talk about?
Yes, I mean, I think that has been pretty apparent that since COVID, there's been a lot of people who have found that they have had increased hair loss, and whether it has been a part of a continuum of COVID, or just something that was from the virus itself that they had at that initial time. It's hard to say. I mean, a lot of those things are hard to say, but I have definitely agree that we are getting a lot more people come to us and say, look, since this time, and since I had COVID, I feel like I have been my hair has been thinner than it ever has been before. And so it's definitely true. I mean, I definitely think that there's a point these last couple of years, and there might be part of it too that we'll talk about as well, the stress factor.
Right.
That might be part of it too. But so I don't know what the true answer is, and I don't think anybody really does. But the facts are that there's no doubt that more people are finding that this is becoming an issue
than it was a couple of years ago.
For sure, yeah.
Right.
So we're going to talk a little bit about the science behind it, what ways are the best to prevent it, and so let's talk about what are the things that we could do, to really help, and the reality is that most important that there is no silver bullet with hair loss. For anybody who tells you that, they're lying.
There's not just one, here's a quick easy fix that's all snake oil, right?
Yes. So we were talking this morning about this, right? That back in the early 1800s, maybe the late 1800s, the early 1900s.
Right.
They used to sell tonic, and this tonic, they said, cured everything, right? And the tonic, but the tonic used to have morphine in it. It would have hallucinogenics in it.
Whoa.
It would also have maybe cocaine in it. And the reality is that, probably, at the end of the day, like, you probably didn't remember what your problem was to begin with. So yeah,
maybe you did feel better for
you
a little while.
definitely probably felt better, and you probably didn't even remember what your problem was anyway. So it probably cured everything because you didn't know what the problem was in the first place.
Right. Or if you're just, I feel so good. Who cares that my hair isn't growing back?
Right, exactly. But
I think it's safe to say that a treatment of cocaine, morphine, and hallucinogenics isn't easily available.
No, I don't
today.
think you can get those anymore.
And
yes. Well, you probably could on the street.
Yeah, on the street, but we don't know if it's pure that hair tonic.
I wouldn't suggest that. Not suggest
No,
that.
that's not. Yeah,
no, this is
stay
not a
away
suggestion.
from the street.
No.
Level of hair loss.
Correct.
Treatment.
Right. But yes, but I think that they would claim this, and so. But the point I'm trying to make ultimately is that although a lot of the new technology is very promising, and there's a lot of really exciting things that have come out, and I think that the most important thing that you can do is that you can combine, the things that seem like they really do have efficacy together. That there's not one single thing that has been shown to be 100% for every single person. I think you can safely say that. There's certain things that work, and then for that person, it's 100% for that person, right? Like I was talking to the producer. Yesterday, and I said, for instance, Rogaine, which is a lot of the dermatologists and healthcare professionals, kind of pose as like the medical gold standard. That's what they say. Like for hair loss, the medical gold standard is Rogaine.
And you can just buy that at the supermarket with your groceries.
Now, do you know what the efficacy of Rogaine is?
No, I have no idea.
40%. That means that 40%. So, and she said to me that it only works 40%. Like, I said, well, it only works for 40% of the people that it does. For the 40% of the people that it does, it works 100% of the time for them. Meaning that those people it's going to work for, it works. But for the rest of the people, it's not going to give them the results that they want.
That's not reliable. I don't like those odds.
Well, that's the point. So that's what I'm saying. So what I'm saying is that our approach and our ideas is that if you kind of combine multiple treatments that have good efficacy, then you'll get better results. So we're going to talk about each one. So again, the first thing that you can do to help with hair loss is prevention.
Okay, right. With all things like we've talked about skincare in previous episodes,
right?
We recommend that you take care of your skin and not wait until it's too late.
Correct.
So what would be the prevention for hair loss?
Well,
I've never heard anyone discuss that before.
Right. So that's a good question, and it's not sunscreen. So Jamie, sit down, Jamie.
Sunscreen cures prevents a lot of things, but not hair loss.
That's right.
So don't go rubbing it in your hair. It'll just make it greasy and probably not. Maybe it will make your hair fall out. So don't use SPF.
Yes, right. So the reality, though, is that the more likely thing is that a lot of things that you're actually putting into your hair actually might be causing a problem. So what the recommendation is that when you're like shampooing or conditioning your hair, you have to look at what you're actually putting into your hair. And so things like, certain preservatives that you're using, certain fragrances that you're using, these are actually often toxic to the hair follicles.
Oh, they're not even. So when I buy shampoo, it just says like no fragrance or no parabens. I thought that was just for the quality of my hair itself, like the hair that's already grown. I never thought that
Right.
it could affect the hair follicle.
Correct. Yeah. And also the pH of the shampoo or conditioner also should be balanced, as well. And so if you buy like the 99-cent shampoo, often these things are not going to be the case. And it's going to be, inexpensive and, cheap. But it's potentially, and you get the strawberry smell, but that might be actually toxic to the follicles.
Oh, so we should really be more aware of your scalp health.
That's right.
And not just the health of if your hair is shiny or conditioned or oh my gosh, I'm gonna go home and check the ingredients in all my shampoo now.
Yeah, I mean, and there's certain things that surfactant is something that's protein that is really actually beneficial for the scalp. It's actually a protein that when babies are developing, which is really interesting, that the surfactant actually develops their lungs, and it's a powerful protein. And it's often in like really good shampoos have surfactant in it, and it actually helps to kind of nourish nourish the scalp. And so that's something that's really helpful, in the shampoos. Azelaic acid is another really good, uh, good product in a lot of shampoos as well. And as well as, um, just making sure that in the rest of the rest of the shampoo there's not any preservatives. Aloe is another really good kind of like gentle kind of product in the shampoo that really is helpful and really does help nourish the scalp. So these are things that you can do that you can really that we can really help.
Good to know. As preventative hair and scalp treatment, this is be careful what chemicals you're putting into those follicles.
And so this is simple, easy, cheap, advice. So that's one thing.
Be aware of. Okay, great.
The other thing is your hairstyle.
Hairstyle.
Yes. So you might not think of this, but things like ponytails, things like braids, actually, the mechanical stress of hair can actually, and there was a study done on this, can actually damage the follicles. And like you said, like you asked before, can scar the follicle.
Oh, so if that would count as trauma, continuous trauma to the head is wearing your hair in a tight ponytail.
Right.
I know the man bun is pretty in trend right now.
Right.
But even as old school as Steven Seagal.
Yes.
His ponytail.
Yes.
So, all right. So if all of these modern men, Brooklynites that are listening, that are wearing your man buns while you're getting your expensive cup of coffee.
Right.
So just keep in mind that can be damaging. That can scar the hair follicles.
Right. I mean, it's very tight, very tight. Hair tight. In that area can damage, and you wouldn't think about it. You would think, oh, that seems like. But it really is true, and there has been studies that showed that this is the case. So that's another thing that you should be thinking about. Excessive heat, something that people think about.
Blow dryers.
Yes, blow dryers. Like the one movie I think about. You remember this movie?
I think you're thinking the same thing I'm thinking. That scene in Saturday Night Fever.
Oh, yes,
with John Travolta.
Yes. And I think he's lost a lot of his hair.
Oh, there's no way his current hair, nothing on his face is real right now. He's had so many fillers and facelifts. Yes. There is no way that man has not had hair plugs.
Yes. So yes, I think that I think I've seen him with his hair, like lost his hair at some point. Like, yeah, I'm pretty sure.
Definitely, because he still wears it in a ponytail right now.
Yeah.
Usually when he goes out, he doesn't have the luscious hair that he had in Pulp Fiction or
Right. Yeah, so he definitely, was the poster child for, high heat, blow drying. But if you go into blow dry, which you certainly could, you don't want to go out and catch a cold like your mom would say, but you can turn it down to like cooler temperature to be able to get the same thing, because the high heat will potentially damage the follicle as well. So
all right, so let's cover the two types of hair loss, and then our producer is telling us that your patients are starting to show up for the day, Dr. Frankel. So we're gonna have to do a part two. But until then, I think we should cover the two types of hair loss.
yes, I think we can for sure. So so like I said, the scarring follicle, and the scarring is the first one, and like I said, it's the damaged follicles, and the second one is the non-scarring. So that breaks down to androgenic, and the second one is something called telogen effluvium. I didn't know if I'd be able to pronounce this, but do you think you could say that, Zoe?
No.
Telogen effluvium.
Okay, I was a writing major, and I still don't. I would not be able to phonetically say that. So what is it? What is the regular?
So androgenic just means hormonal, right?
Okay.
So that's the common one, and that's and that there's a lot of different things that change. The that change, and that's both women and male pattern. Like the male pattern is going to start kind of in the center of the scalp, and then kind of come forward. Women actually kind of their hair loss, which is hormonal, starts kind of like in the part of their hair, and it kind of like starts and it kind of like goes outward. So that's usually how their hair loss kind of like develops. So that is really
where, as opposed to men who see it like have a receding hairline.
Receding hairline, exactly.
Or the crown of their head.
And the crown, and kind of like comes forward. So that's androgenic, and that's like that is what we really kind of focus on, because that is a lot of what we can work on can be taken care of. Now, telogen effluvium. Now that I could say it,
congratulations, that was great.
I'm going to say it a lot. Actually, I'm going to talk to you about telogen effluvium all the time.
All right. So when you're talking about it, what does that mean, so I can understand what you're saying?
So telogen effluvium means that basically it's stress-related hair loss, and so it could be caused by a few different things. It could be caused by stress, depression. Could be changes in weight as well, is something that happens, like rapid weight gain or rapid weight loss. Hospitalizations happens with people, sickness, and so it often is some type of either metabolic or psychological state that can actually cause people to lose their hair.
Wait a second. My psychological state is very telegenic effluvium. Look at me, I can say it now too.
Yeah.
I don't manage my stress very well.
Yeah.
And I think my hair is thinning. Is that something that can be treated?
Yes. Well, yes. I mean, it can be helped. Usually, it depends on if the state is transient. Sometimes it could last for up to 2 years, but if it's consistent, it could actually trigger the androgenic phase too.
Oh, that's not good.
Right.
Okay.
So that's the thing. That's the one thing about telogen effluvium that you have to be careful with, because sometimes it can start as just like a transient thing, but it can also trigger the androgenic. So like the people who had gotten sick and were in the hospital, and then you notice that their hair was thinning, and then all of a sudden that their hair continued to thin years later, because like the true, like the definition of telogen effluvium, that should only last for about 2 years, but it can trigger into like true androgenic, androgenic hair loss. So,
All right. Well, we don't want to trigger telegenic effluvium, hair loss. So, but however, we are going to leave you guys on a cliffhanger
yes,
on how to, what are the treatments for this. So now that you have a little bit more understanding about the different kinds of hair loss, then in the next episode, in our part 2, then we'll tell you how to treat it. Dr. Frankel will give us more details in that. So try not to let it stress you out. Your homework is to check your shampoo and conditioner, see what the ingredients are, make sure that it's not something that can damage your hair follicles. So that is your homework. And until the next episode, we'll be able to give you the solutions on the different treatments if
yes.
you are already experiencing hair loss.
That's right. So yes, I think this is a good place to stop for the week, and we're going to kind of get into the treatments for the next time. So I think this is a perfect time because because we kind of got to the point where we discussed like where we're at, where we can get to, and now we're going to the next episode. We're going to talk about the treatments. So
the solutions to the hair loss problem.
Yeah, so all right. So please listen to part 2 next week, and we're excited to have you. And I'm excited to talk about it because I think that's going to be really where the excitement is all about. So
absolutely, dun dun dun. Until next week.
Okay.
Thank you guys. Remember to like and subscribe wherever you listen to podcasts, and we'll see you next week.
All right. We'll see you next week, and part 2 is coming next week, and we'll be excited to give you the answers to the question, and we'll see you soon.
Bye.
Bye.